little bit about patellar instability or kneecap instability. So the patella is just another name for the kneecap. And in a lot of our younger athletes, we can see patellar instability where the kneecap actually comes out of joint and has persistent sense of instability and even recurrent dislocations. And you know, the kneecap is here, and we call it the patellofemoral joint because the patella and the femur have a little joint together, and basically the kneecap sits in its little groove right here. And fortunately for most of us, it makes the right decision and goes into its groove every single time we bend our knee. But occasionally for some of our patients, it will make the wrong decision or it'll get forced out. And almost all the time it comes out laterally or out to the outside part of the knee. In very rare circumstances, you can have medial instability, but it's almost always lateral instability. And then either by itself or by straightening out the leg, it comes back in. And usually our patients will present with pain and swelling, and they'll have a little bit difficulty getting around as a result of that, and it'll be swollen. And so normally for a first-time dislocator, if you've never had this before, we try to treat this without an operation. We try and get all these ligaments to kind of scar in and heal in. But sometimes if they don't scar in well enough, you can have recurrent instability events. And once it keeps on happening, it's more likely to keep on happening. And so that's when we start talking about surgical stabilization of the patellofemoral joint, or just doing a surgery to keep this kneecap in place. And there's multiple different variations of how we do this. I typically take an anatomic approach to try to address your specific anatomy when we're treating this. But what we used to do is we used to go just kind of tighten up the tissues over here. We called it a medial reefing, just to kind of try and tighten those up. But it kind of had a little bit of a higher failure rate than we wanted it to have. And so now what we do is we do what's called an anatomic medial patellofemoral ligament, or Mpfl reconstruction, where we basically make a new ligament from the kneecap down to the femur bone right here that acts like a new leash basically. And what it does is if the kneecap's about to make the wrong decision and it's about to come out of joint, it basically pulls it back in and keeps it from making that bad decision, all right? Now, some people have some unfavorable anatomy that predisposes them to having a really unstable joint there. Some people's patellar tendon here is situated very laterally, and so kind of the line of pull is just kind of pulling it laterally like this. You can see how that would really want to make it go out this way, and there's some certain measurements that we can make on the studies and just looking at the knee when we examine you that can help us determine if you have that situation going on. And occasionally what we have to do is we have to reorient that by kind of doing what's called a tibial tubercle osteotomy, where we basically take that insertion, move it over, and fix it back into place so it's a more direct line of pull. In very rare circumstances, the groove that the patella sits in is very shallow and what we call dysplastic, meaning it has a very abnormal anatomy that really predisposes it to having instability. In Europe, they do a lot of reshaping of that groove. It's called a trochleoplasty. It's not something we do here a lot, but it is an option for our patients who have really bad trochlear dysplasia and recurrent patellar instability. So to summarize, I almost always do, if we're talking about surgery, a medial patellofemoral ligament reconstruction where we're making a new ligament from here to here. And then if your anatomy needs it, sometimes we will do a tibial tubercle osteotomy to move the insertion of that patellar tendon over for a more favorable line of pull. And that is something that we will specifically talk about in our visit and talk about all the options regarding that.